Medical Dilemma.
Oh, no, Chief Justice,
Welcome back to Medical Dilemma. Before we start the discussion for the second segment, I'd like to mention our major sponsors, St. Clair's Medical Center in Palanan, Makati, Makati Medical Center, Life Quest Training Consultancy Corporation and its partner Manila Workshops, and of course, the Basilica of Our Lady of Manaoag. Now, joining me for the second segment are my co-hosts, Attorney Sara Sugitan.
Hi, Sunny. Welcome back to the show.
Yes,
We
thank
missed you last week.
Yes, that's right. Okay, and Father Jerry Manlangit.
Hi, Sunny. Good afternoon.
Good
Nice to
afternoon,
see you
Father.
again.
Yes, again, and Dr. Tess Sanchez.
Hi, everybody.
Okay, now for the continuation of our discussion on prostate cancer, earlier you mentioned that as a first treatment, first step, you have to offer surgery. Okay. Now, if a patient does take surgery, how does it affect the sexual functioning of the person?
Of course, it can be affected. All right.
Do you ask them
Yes.
after?
That's one of the questions you have to ask them. Are you sexually active? Because there's a very good possibility, like 30% of the time, that you either have a temporary erectile dysfunction or a permanent erectile dysfunction.
For surgery?
Yes.
Nako, baka ma-discourage ang mga male population natin ngayon.
It's temporary.
It can be
Many of them-
temporary.
Many of them are temporary.
Yes, because after surgery, of course, the area is swollen,
Oh, yeah.
maga, and then after 4 or 5 hours of surgery, and it will take a while, like usually 5-6 weeks before they regain their function. But for some, unfortunately, especially if the cancer is very near the nerves, which is responsible for the erection, sometimes it's either hard to see or it's just there. It's so near the cancer that they cannot spare the nerves. It can be severed. And this can cause permanent damage to the erection.
Okay. And such a condition cannot be mitigated with drugs, like Viagra or
Well,
Cialis.
if it's temporary, sometimes as early as 1 day after the operation, they start giving the medicine, so that by the time they recover, hopefully the erection also comes back.
But my gosh, with just 4 weeks rest, I mean, cannot a man wait?
Well,
Too much libido.
well, I don't know, but I heard.
What? Heard what?
No. It's after undergoing that long a surgery, and of course just surviving cancer, of course this gives man new hope that I have to live my life as as if I was reborn. So they want to go back to how things
Their
were
old
as
practices.
fast as they could.
There's now a prohibition there, no restrictions.
Well, for as
From
long as
the
we know that everything's
health point
okay,
of
at
view.
least a month after surgery. But if you can delay it like 1.5-2 months after, so we know everything's okay. By all means, they can
No
try.
risk of infection or among others.
But it's pretty rare that patients after 2 months will have erection already.
But
Takes a
still,
while.
In that case, surgery still is a dilemma for the sufferer, because he may recover from the cancer, but he does not recover his usual, masculine way of life.
Did I hear it right that you said it's advisable for about below 60 people?
Yes,
Those guys below
65 and below, surgery is the #1 option.
Okay.
But as I mentioned a while ago, in terms of choosing what you want for the patient, you have to ask them. Also, it's also the patient's choice, because #1 dilemma will always be erectile sexual function. If they are still sexually active, that will always be a question of debate.
Doctor, when it comes to deciding for the treatment, would you usually ask for the wife, for example, to be there for information, education, because the wife might also be surprised. Why it's like this, like that? He has never been informed as this, as that. Why are you like this? Something like that. Would you recommend as an ethical duty on our part as a doctor?
All right, it's like this. For me, almost always the couple is there. Now, I always tell my patients what the options are, and I never tell them to decide right there and then what they want. Because as by experience, patients, if you tell them what their diseases are and what should be done, after you tell them what they have, they can no longer process what follows because they're in shock.
Right.
Yes. So I always tell them that maybe you should sleep it over and talk to your wife about it. If you want, whoever, when you come back, whoever will help in the decision making, ask them to go with you to the clinic so that we can talk about it some more. And if they have questions, just write it down, because chances are when they come to the clinic, they will again forget what the questions are. But yes, I do always advise them to bring their wives, their partners, their children, if and when
Even
necessary.
the children.
Yeah, even the family, because we Filipinos by nature is a close-knit family.
Right.
So decision of, although legal point of view, I think it's the patient who had the right to decide. But of course, whatever the family will say will always have a bearing.
What is your observation about, men having this surgery? Well, obviously we have some physical or sexual changes, something like that. Maybe temporary, maybe permanent, but the psychological confidence of the man, for example, do you have any information about that? So that, we'll tell now the man.
Okay, so fortunately, for me anyway, for most of my patients, at that time, they have lost interest in sexual function simply because, one, they can no longer achieve, and then of course the libido.
Does it go
They have,
down?
no, even before the operation.
Okay.
Even before the operation, it's gone already. So they don't mind undergoing the surgery. The problem always lies when, they feel like they're still at their prime.
Okay.
Because that will always have a long debate and long conversations with a patient, with a wife. Sometimes they don't want the wife to know, because you have this. They don't want the wife to know that it's going to be one of the side effects. They want a one-on-one conversation with the doctor, simply because we have this macho image.
Right.
I can undergo this, but afterwards, I can still perform. That's why when realizing that is one of the side effects, they kind of back out and not tell their spouses that the main reason why I don't want this is because I'm still active. I don't want to sacrifice that possibility of having an erectile dysfunction after the procedure.
Can it be delayed? I mean, the operation, can it be delayed? or
Granting that it's really early stage, stage 1, okay, or stage 2, 4, 5 months delay, 6 months delay won't make that much difference.
what? Oh.
But of course, we don't want to wait
Months
a
only.
year. So
So
you
6
have like
months
years.
at the
yeah,
most
you have like 6 months to do it every day to make up for it
to make up for the rest of the
for
life.
the rest of your life. But it won't make any difference if it's that long a period of time.
Wow.
Now, if the patient decides against surgery, what are his options?
Well, radiation. As I
Radiation.
mentioned, yes, I mentioned
Will-
a while ago.
Is it not a side effect of the radiation or likewise?
The chances of you having erectile dysfunction after radiation is lesser.
Yes.
Lesser.
It's less than 20%. So if you're talking about a 10% difference, that's for a man
That's a
who's
big-
sexually
that's a
active,
big
that's a
probability,
lot. That's a big
yes.
margin. So the only drawback there is it's done every day. So you have to keep on going back to the hospital 5 days a week for 8 weeks.
And supposing it becomes unsuccessful, sometimes there is still remnants of it after the radiation. Any other option? You cannot go back to surgery already,
In
right?
any, Doctora, in any procedure, there will always be a chance of recurrence. Now, for this, they say, depends on what you read, okay, the recurrence rate of radiation and surgery are the same or similar. Okay, they're not statistically different. But the main advantage of surgery is if it fails, if cancer recurs, you can do radiation. The main disadvantage of radiation is if it fails, you cannot do surgery
that so?
anymore because the area is so dense and so it's like going through a forest.
Yeah.
It's very difficult. We have a lot of complications. You may injure the intestines. You may injure other organs that will cause a complication.
But can you do additional radiation? After
If
that.
the area is again in the prostate, you cannot. Because radiation, there's a maximum dose. After giving that, even if you give more to that prostate, it will not absorb anymore that radiation.
Okay.
But it most probably will harm other organs.
So what is the life expectancy after this recurrence, for example?
Well, we can do medical treatment. So there are a lot in the market that can stop the progress, not really cure it. Okay, it can. These are the anti-hormones because the hormones are the ones that feed the prostate. So what we do is we give something that stops the hormones from producing. But if you stop this, the cancer will again grow. If the patient responds well with this, it's as good as life itself. But unfortunately, some of the patients, after taking this for quite some time, no longer respond to the medicine.
I see.
So like how many years, for example, untreated would be
Untreated,
after the operation?
after the
yeah,
operation,
or the radiation?
minimum 2 years, minimum. But some can still live at up to 5 years
Up to 5
because supposedly it's an early stage. There's just recurrence. Before that cancer cell grows, it will take some time.
Okay, so we'll have to hold our discussion first for a commercial break. Don't leave this channel. We'll be right back after a few words from our sponsors.
our products were designed to be used in industrial and medical economy.
So if I were you, I would be a lot more careful about what comes out of my mouth, especially in such a place where anything can spread like wildfire.
When you share something to a public, you find that experience, and that experience so rich it could change other people. Okay?